Oh, thank you very much. Thank you for whoever did that. Robin, thank you. Go ahead, Annalicia. I apologize for
Okay,
interrupting.
great, no problem. There should just be a blank screen right now. Um, so yeah, I would really say that my journey um, as a humanitarian began when I was in grade school, and I would say that I tend to describe myself as a humanitarian with a clinical background. I initially turned to medicine partly from encouragement from my parents, but also an interest in global health. So when I was in fourth grade, I was living in Illinois at the time, and we had some missionaries who came to our church to talk about the kids that they had been helping in sub-Saharan Africa. And I was 11 at the time, and it was really the first time that I became aware of this idea that your life circumstances can be so completely influenced by where and when you're born. I also realized in that interaction that in this lottery game of life, that I had been dealt a very different hand um, than the kids my age, dealing with issues like parasites and not having enough to eat and all sorts of different challenges just because of where they were born. And that was around the time I knew that I wanted to work on that kind of problem. And so I remember telling my mom that I wanted to be a missionary, and she said, "Honey, I think you could really have an impact on people's lives if you were a physician or in healthcare." And I took that to heart, and I said, what, that's a great point. So I ended up continuing on the academic path towards getting an MD. But along the way, I did continue developing my interest in understanding how and why other people have very different lived experiences from mine. In college, I ended up studying anthropology, which is the study of different cultures and how sociocultural dynamics can impact a person's worldview. And I really love this quote. I think it sums up that why I'm so passionate about the field. Just this idea that perhaps through realizing human nature in a shape very distant and foreign to our own, we have shed some light on ourselves as well. And so I think that's just a fascinating concept. I'll also mention that my dad is American, but my mom is Australian. So I was actually born in Australia, and I've always wondered, how my life would be different had I grown up primarily in Australia, or if I had been born 100 years ago, or in Asia, et cetera, et cetera. And so, with that in mind, as those of you who are familiar with the medical school admissions process, if there's anyone on the call, as you might know, you need research on your resume to be considered as an applicant. And I was not a traditional fan of lab work, not a fan of test tubes or beakers, anything like that, which is why I'm so grateful that we have folks who are very passionate about that kind of field. So I instead ended up working in undergraduate in an archaeology lab as a part of my anthropology studies. So I ended up traveling to Belize to work on site for a full archaeological field season, looking at the ancient Maya, which at face value does not have a lot to do with what I do today as a clinician, but I do think it's really important to try and understand how the world can look to different people. And I just found it just endlessly fascinating trying to understand what it was like for people who had accomplished so much in a very, very hostile environment. They built massive pyramids without the wheel. They had all sorts of beliefs without any philosophical foundations like Plato or Aristotle. And they had very impressive astronomical discoveries without any of the tools that we've used in the West or inherited from the Greeks. And also things like chocolate. And I think that cultural sensitivity has really carried through with my ongoing interest in just the not just the lived experience in terms of celebrating what others uh, have created and developed, but also the challenges that people can face in different settings. I in medical school, the next really international experience I had was traveling back to Australia to do a rotation with the Royal Melbourne Hospital. So I worked with the Victorian Infectious Disease Society while I was there. And while it's not what you might traditionally think of in terms of global health, It was fascinating to work within a universal healthcare system. For those of you who are not familiar with Melbourne, Australia, it's a very, very cosmopolitan city. And so they have huge numbers of individuals, both traveling around the world, but also coming from different places. So with that comes a huge variety of disease that can be endemic to different regions. And so I had the opportunity to take care of patients with leprosy, various forms of tuberculosis, things that we just don't really get much exposure to in traditional medical training in the United States. And so I found that to be very enlightening as well in its own way. After graduating from medical school at the University of Florida, I headed up to North Carolina, where I did my pediatrics residency at Duke University. And during that time, I continued my interest in health disparities around the world. So did some research on orphans' living conditions in different low resource settings. I was originally supposed to go to Tanzania, but I was halfway through my training when the pandemic hit and lockdown started. And so I ended up not actually traveling at all, but did continue my passion for global health. Here is a picture of me when this was, I think, April 2020. I ended up running a testing site as a physician trainee while at Duke for a few weeks. And additionally, because I didn't go to Tanzania, I also had the opportunity to work with the Global Health Council, which is a think tank advocacy nonprofit based in Washington, D.C. So I worked with them remotely on their advocacy team. And that was a really great opportunity to see another different side of global health, more so the policy arena. There was more legislative advocacy. So it was a really great learning experience on how to really find your voice in those settings and use that voice to pursue and further causes that you feel passionate about. As a part of that, I also was able to attend the World Health Assembly, which is the WHO's their major annual meeting. And so as a delegate, I ended up having the opportunity to speak on the floor of the World Health Assembly, which is one of the coolest things I've done, and a very, very humbling moment to get to speak on behalf of women's and children's health around the world and try to advocate for those types of causes. So that was pretty cool. After finishing my training at Duke University, I ended up coming out to Stanford, where my husband is currently pursuing his medical training as well. And during that time, I started here in 2021. So in February 2022, as we all know, Russia began its invasion on Ukrainian soil. And given that this is the largest land-based invasion in Europe since World War II, I found myself, like so many of you, I'm sure, just scratching my head asking, what can I do to try to help these people? Like this looks terrible. And so ended up getting involved in a grassroots effort that was based in the Bay Area. And so ended up fundraising and was just amazed at what was able to happen when very motivated people from around this area came together. And so our team was able to not fundraise not just for the medical supplies, but also the plane that we chartered to take those supplies over to Poland and then into Ukraine. And that was largely in partnership with the team called Nova Ukraine, which is a Bay Area-based diaspora of Ukrainians. The organization, the team that had been based at Stanford is now formalized into a group called the Ukrainian Student Association at Stanford. And so as a part of that effort, I was one of the folks who actually went over to Poland and then into Western Ukraine to help oversee the administration of those supplies. And as a part of that effort, found that I was coming into contact with not just people on the ground, the displaced Ukrainians within Ukraine, Ukrainian refugees in Poland, people running safe houses for those refugees and displaced persons. We talked to the Ministry of Health multiple times, and just we're coming to find that with all the upheaval and disruption that was happening there, a lot of people really couldn't access their routine medical care. And then there were also the very acute concerns that come up with being in a conflict setting, such as has been happening in Ukraine and in different parts of the country. And simultaneously, we had a lot of folks back in the United States in different areas who saw what was happening and like myself and many of you, wanted to help, but didn't necessarily know how. And many people were unable to travel into Ukraine for various reasons. And so we connected those two, the need that we saw there with the interest of folks overseas, and created a nonprofit called Telehelp Ukraine. This was a telemedicine, or is a telemedicine platform that connects those Ukrainians in need with both physicians and mental health providers, primarily in the United States, but also in other parts of Europe, to Ukrainians so that they can access basic medical care, but also mental health services, which has been a strong, an increasing need, I should say. One thing that I noticed in doing this work, well, first off, I'll say that I had the privilege to meet some really, really amazing people who were working in this space. I've listed a couple other organizations here. And as mentioned, I am now involved with Health Tech Without Borders. I have since stepped away from Telehelp Ukraine after having my daughter 10 months ago. But through Health Tech Without Borders have since expanded into some other countries as well that have approached us about setting up these telemedicine services. And what we've come to find is that while there is a lot of interest around the world, we found ourselves asking, why did it have to be these organizations coming in to set up these efforts rather than, Ukrainians having the ability to set up telemedicine services for themselves in the way that they wanted to. And so since that point, we, as mentioned, the folks from those other organizations, we put our heads together and really didn't find much that is in existence currently in terms of best practices, like helping people learn how to build a telemedicine platform, because it's much, much more than just a Zoom meeting. There is so much that goes into scheduling, interpreting if you're using physicians in different who speak different languages. There's legal considerations when you have providers in different countries or across different types of borders. And so lots of moving pieces that can be very dependent on the situation. And so recognizing this need, we have since segued into a focus on education. And so have been in communication with the World Health Organization's new WHO Academy, which is an educational platform that is both remote and virtual, as well as in person, and that is set to launch later this year. That should be launching this fall, and the Academy itself is targeting healthcare professionals and community health workers around the world to help them find a consolidated platform with educational materials. And so we are in the process of proposing a course to them that will share those best practices and show teams how to build the services that many folks are already attempting to build or have attempted to implement and have found challenges for different reasons, and really give them a space where they can come and get some much needed support to build really sustainable interventions. So with that, we've also I also had done some work with the United Nations Institute for Training and Research, but I also wanted to touch on the work that I'm doing with the Measles and Rubella Initiative. And I say but I really need to emphasize the fact that much of what we do is a team effort, and that none of what we've accomplished would be done by myself. And I am fully aware of that, and it has been such a pleasure to work with the team. So as Jill had mentioned with her lovely introduction, there are the Measles and Rubella Initiative is a partnership. And so our team in Northern California is just one small piece of a much bigger pie. So working within the context of the American Red Cross's portion of this team, in the past year, we have been able to accomplish quite a lot, and I want to give some acknowledgement to the team. I think Dr. Joe Clendenin is still on the call, so thank you, Joe, for being our fearless leader. With his inspiration and guidance, we have done multiple efforts and are working on a few active projects as well. So we have been very involved in youth education and youth engagement. We are planning for a health career symposium for underrepresented in medicine demographics. So high school students from the Bay Area can come to one consolidated symposium day in person and get some mentorship, some guidance. So with this inaugural effort next month, I'm hoping that this will kick off what should be an annual event. We are also working on a documentary that'll be a series of short segments, very digestible in today's media environment, to help educate high school students and anyone else interested in vaccine awareness, vaccine preventable diseases, and vaccine hesitancy. So that's been very exciting. And then we've also done some other curriculum development for nursing students. And so that has been ongoing as well. But when I talk about these different things that I have done, I can share some insights for, some general practices or principles that can help anyone who is interested in doing this kind of work or being involved in this space. I think we all identify needs, and that's part of what brings us to gatherings, discussions like this, involvement with the Red Cross or similar organizations, and whether related to health specifically or other fields. I think humanitarian work doesn't necessarily mean what it used to. I could say that for sure about global health. There are so many skill sets and fields that can be utilized to help meet the needs of today's underserved populations, both within the United States and abroad. I think we can work to empower different teams, like those telemedicine teams I had mentioned, to really access their own full potential, whether in terms of disease or disasters. And so I wanted to just touch on a couple of suggestions and insights that I have gained across throughout my academic and career journey at this point, to help you feel empowered to work towards whatever goal you have in mind. So one thing that we have utilized in the medical setting is something called the Vote ER nonprofit effort. So this is basically just helping register folks to vote. If you are based in the United States, which I think the majority of our audience is, as you know, there's a very big election year coming up. And so helping people access their voice and to participate in democracy can have huge implications for humanitarian outcomes. There is a vote coming up this weekend on multiple foreign aid bills. I guess later this week, I should say. And so that's just one example of many different ways that participating in our own domestic legislative process can be very helpful. So this is one example of a way that you can participate, not just yourself, but also spread awareness and empower others. Some of you may have heard of the concept of effective altruism. This is both a research discipline, but also a practice community. So it's just the concept of figuring out how you can do the most good for the most number of people, but try to do so in more of a scientific way. And so it's not necessarily focusing on one particular cause. It can be applied to everything from global health to animal welfare to climate change, et cetera, et cetera. And I think that one of the most interesting pieces that comes from the data when we really look at this kind of concept scientifically is that what is the most effective in terms of saving lives or improving outcomes dramatically is not necessarily what makes you feel the best. And so whether it's thinking about how to shape a career or use your time as a volunteer, or you're considering, donating to different causes, there are some different ways to break that down more rigorously and ensure, because it gets very messy very quickly, very opaque when you start trying to figure out, is what I'm doing making a big difference? And there's a lot that can go into that kind of discussion. We could definitely fill a full hour talking about it, but I just wanted to introduce you to the idea. Within that space, there is something called the 80,000 hours campaign. So this is a tangential nonprofit effort and just is focusing on this idea that you have the average person working a 9 to 5 for about 40 years has about 80,000 hours in their career. And so no matter what stage you're at, if you are a student just trying to figure out what you want to do, if you are, looking at a career change, or you're at the twilight of your career or retired, but still wanting to figure out how to have an impact, this resource is excellent in just helping you work through what drives you and what skill set you have and how to align that in a way that can have very tangible outcomes. So this is just a screenshot of their website. And one thing that I wanted to highlight is that they have the opportunity to get one-to-one advice. So you can actually meet with someone from their team, and they will help you work through that thought process if that's something that you're interested in. So as I can say, for my own journey, it has been challenging to find guidance and support when you are going off the beaten path to pursue different goals. And so finding this community, I think, is very exciting. And so I'm happy to talk about that additionally if that's something that you're interested in. But just to summarize, I would say find your spark, whatever that North Star might be for you. Let it guide you towards a destination, but definitely be willing to be flexible about the journey. And please recognize the power of a very strong and supportive team, because I think none of what I have accomplished so far in my career would have been possible without some of the very wonderful and very talented people around me. So that is all I had for you. Jill and I had discussed keeping this very conversational, and so I'd love to open it up to questions and see what thoughts and feedback you have for me at this point.
Before the questions, I'd just like to acknowledge somebody who I don't think is still on the line, but who also, along with Joe Clendenin, Dr. Joe Clendenin helped a lot, was Ken Toren, who took it on as staff person with a myriad of other things that he does in life. And there are a number of people there are accolades for every single person who works on the measles team. You've done an incredible job building it up within 2 or 3 years to what it is now. And thank you, Annalicia, for doing that. Hey, Ken, thank you for being on. You're amazing, the support you've given. Thank you.
We're all big. We're members of the Annalicia fan club, so we're thrilled that she's so engaged and involved. She's terrific.
It's
Joe
wonderful.
And the whole group is great.
Yeah, please go ahead and ask your questions. This is your time to ask questions, talk about comments, share your comments about what you've seen. And if not, I have a question for you, Annalicia, but I'm going to wait to see who's going to pipe up first. Don't all jump at once.
I will say thanks for joining, Ken. I didn't realize you were going to be on the call today. Nice to see you.
I'm glad you had a nice surprise guest. And what I was going to say is, does anybody want to unmute and ask a question? For those who have never known, go ahead. I'm sorry.
Oh, this is Patty Wataha. I have a question.
Please go for it, Patty.
Okay. I am with the Red Cross and I am involved in youth groups, mainly high school students. And I'm just curious about this 80,000 hours during your lifetime program. And I think that would be fabulous to introduce to high school students. How would I go about getting in touch with them?
I completely agree. Yeah. Their team seems like it's very accessible. I have not actually connected with them directly, but on their website, just 80,000 hours. If you just Google 80,000 hours, it takes you directly to it. But there are multiple ways to contact the team. And so I think talking to them about what they've already done with high school students, or if there's anything in existence. If not, I'm sure they'd be very open to innovating and collaborating with you.
Okay, great. And thank you so
Yeah.
much. This was wonderful. You're great.
And then
Good, I'm glad.
Lilani has asked, how do I join? I love it. Thank you for your service. And Lilani, would you unmute and say what you want to join? If you want to be part of the measles regional team, or if you want to create your own, what did you want to join?
Yes, hi, this is Leilani from Red Cross in American Samoa. Yeah, I'd like to join the international measles team and whatever else. It's pretty much up my alley. I care for a lot of children here, let alone families that are living in poverty here, and just trying to get them back. American Samoa is pretty good and keen on getting the children vaccinated. However, because it's free. And so we're grateful for that. But to reach out and to be of service in a global capacity, that it really touches my heart. So that's where I'm coming from.
Annalicia, do you want me to help you with this?
Yeah, since you're more involved in the international piece,
Sure.
that would be great.
Leilani, one of the ways that you can get involved, and I'm going to give you his email if you have a pencil, or you can write it down someplace on your computer, and I'll put it in the chat later on. He runs the Measles Partnership outside of Washington, D.C., and he would know in your region, in American Samoa, who you could contact there to start. And he can help you also, since it's a national program rather than a regional program. He can help you with that. His name is James, James, period, NOE, at redcross.org, and he's wonderful. When I was working with measles, he came on. He has been so supportive of every region and every innovative program that around the United States around measles. And so I'd recommend talking to him. And of course, you can always pick Joe Clendendine's brain or Annalicia's brain. I'll put it in the newsletter for next week, so you all have it. And you can always contact them or Ken. And if Ken I have permission to give your email out, so that you can always ask them about how to do it locally, how to start it locally, and how to begin, because it's a journey, and it's a really joyful journey, but it's a challenging one at times. So you'll have lots of people who've been involved in it. Yeah. Does that answer your question, Rolani?
Yes, ma'am. Thank you so much.
And thank you for coming from so far away. What time is it in your place?
Right now, it is 10:39 a.m.
Oh, good. Okay. So we didn't have you falling asleep. That's wonderful.
No.
I thought it might be 11 o'clock at night or something.
No.
And then
I feel pretty under the weather.
H. Oh, yeah. Laura H. has asked, when do you expect your documentary to be out for sharing? And Annalicia and Joe, you know this probably better than anybody. I don't.
Yeah, Joe, do you want to take this one?
Yeah, well, it's a picture in progress, so
yeah,
it's probably going to be 5 to 7 mini documentaries. Our first one is just identifying what are infectious diseases. We're putting the team together, videographer, graphics people, all of us volunteer to help us. And I would just say while I'm here, Annalicia, she is a diamond in the rough. We are fortunate to have her. She has been a major resource for our team. Our team comes from 6 different nations, and we have 9 people, and it is really a team. They all enjoy it. They work together, and people are interested. They can contact myself or Annalicia or James Noy, and it's going to go forward. And I would hope a year from now we have all the documentaries done and approved. So we'll see how it goes.
Joe, thank you so much. It's a joy to see you again. And then there's another question. Comment. Diane St. Dennis says, Annalicia, I'm looking forward to meeting you next month at the symposium at Stanford. So somebody is in the realm, I believe if it's Diane St. Dennis, she's one of the leads in Santa Clara County for nursing. So hopefully you'll get to meet her. She's an amazing human being. Yeah.
Yeah, I will be there. I will see you then.
Okay, let's see. Any other questions?
I was just going to say, Joe, thank you for the kind words. That was very, very sweet. I see.
Looks like Jane Dean hand.
Yeah.
Yeah, Jane, go for it.
Hi. I'm just reading some notes that I took. I'm curious about the telehealth Ukraine, and you mentioned about educating them. I mean, where do you even start with that? I mean, is there the telehealth without borders? Are the Ukrainians or even the Russians or anyone getting any sort of medical help through telemedicine? When you said you're going to focus on education, do you mean you're trying to help the Ukrainians set up the telehealth programs? Is that what you meant?
So it sounds like there's a couple questions there. First off, when it comes to building telemedicine sustainably, we can talk about Ukraine, for example. So the Ukrainian Ministry of Health had been working on implementing telemedicine within their national health system since before COVID. And a lot of countries around the world have been trying to achieve the same. There are different barriers that can come up with both just the initial activation energy to build a telemedicine platform. And then there's the sustainability piece. So during COVID, for example, a lot of areas and teams were able to come together and start up a telemedicine platform, or even just something like a WhatsApp communication service. But those systems ended up not being very sustainable. And so some of the barriers that we see when we look at why these efforts are not successful in the long term can include lack of access to just the foundational technologies, whether that's the hardware piece, if people don't have access to computers or reliable internet, or mobile phones, et cetera, that obviously can be a non-starter. And then there's the software piece. So if they don't know how to access a telemedicine platform, or not do so in a way that protects patients' security. So data security is a very big concern in a lot of different areas. When we were working in Ukraine, for example, we would not ask patients their location, just in case any of that data was able to be accessed by unsavory parties, we can say. And so helping teams understand what resources are out there, both to access those foundational pieces, whether it's understanding what telemedicine platforms they can utilize, or other pieces of digital health that they may need to build a sustainable telemedicine service. So that can be scheduling services. If you have a patient, how do you follow up with them after their first visit? How do you make sure that happens? There's lots of different pieces that can go into it. So just creating a resource. There are some written documents that have been put out by the WHO on how to do this effectively, but I think people they thrive much more, and we set them up for success if they're able to interact with a team that can answer questions and or learn from a team that has been able to overcome whatever obstacle they're encountering in an effective way. So I'm sorry, you had asked some other questions. The educational effort that we're focusing on is not necessarily targeted towards Ukraine. They have since been pursuing some different efforts for telemedicine implementation within the country. One challenge that you can also encounter is getting sustainable buy-in from different stakeholders, whether that's patients and providers who, providers don't feel like they're getting compensated the same way that they would in person, or a lack of technical literacy. So patients don't know how to use the technology or don't know that it exists or how to, set up an account, et cetera, et cetera. And so we are hoping to help educate on those different pieces with different teams coming to us. Not necessarily, I will say medical education can also be a piece of digital health because you can connect with other folks from around the world like we're doing right now with digital means that we really wouldn't be able to do successfully without this technology. So it's a multifaceted area. Does that answer your question, Jane?
It does. Thank you so much. It's just like opens a whole can of worms. It's a very big job on your plate there, but it's appreciated. Thank you so much for your explanation.
Yeah, of course. I will say too, since this is the International Humanitarian Law Group, we found it fascinating. The question would come up about liability. So whose liability takes precedent if I'm working in the United States but taking care of a patient who's in Poland, for example? And the answer to that question is basically the location of the patient is what dictates the legal parameters surrounding their care when it comes to digital medicine. So even if they're a Ukrainian citizen living in Poland currently, receiving care from a provider in the United States, the only piece of that matters is the current physical location of the patient. So I thought that was very interesting.
There's a question in the chat, which Ken partially answered, about your wonderful youth symposium that you're doing that sold out in the first week. But are you willing to talk to Red Cross clubs in different counties, possibly virtually, on measles rubella?
I think I don't want to speak for the whole team, but I think that there would be interest. Joe, are you still on the call? Do you want to chime in?
Yeah, I think we're open to anything.
Yeah.
We kind of get different ideas. We bring it up as a team item to discuss and decide what we want to do and, things that we may not want to do, but if we do them, how we're going to do it. And, all of the people really work well together and they're very smart. They're very young.
So to answer your
Yeah.
question, Laura, yes, they will. Anybody from the team, and including Annalicia, would say yes, they would be willing to speak. I'm assuming. I can't speak for Annalicia because of her time schedule. She is not only a mother of an 8 or 9 month old, but she works full time for Stanford. And she also does the Measles Rubella Initiative. So I can't promise anything, but I know you have a wonderful team and they tag team each other and help with each other. Yeah.
Yeah,
and then there's another question.
I'll just say really quickly, Jill, our team's very excited about youth engagement and youth education. So if you reach out to us, we're happy to explore different ideas to collaborate.
Super.
Also,
Laura?
the symposium, sorry, the last thing, the symposium will be recorded as well. So we can figure out how to share that. Some of the information might be more specific to students in the Bay Area, but a lot of it is just career advice, including a resume workshop at the end of the day. So should be very useful for a lot of students. Go ahead, Jill. Thank you.
No, what I was going to say is maybe you could put Annalicia, your email in the chat if you're willing to. Laura
Sure.
H says she's on the East Coast, so she might need some pointers for being on the East Coast. And she's one of the ones that asked about the Red Cross Club. So yeah,
okay.
You and Joe can get in touch with her if you put your email in, or if Joe does.
Yeah.
That would be great. Any other questions? There's one other question I think that just came in the chat. There are 2 virtual conferences a year nationally, Laura's mentioning, and they've had James speak once. So thanks for the information. And then Mick says, any reports available from your group concerning specifically on the ground mental health disaster interventions from your experience?
That's a great question, Mick. We have a so the Telehelp Ukraine team has a quality improvement team as well as a research team internally who have been looking at ways to not just improve what we're doing as an organization, but also how to share some of the lessons that the team has learned over the past, what is it, two years now? Wow. And so we actually have our first manuscript under review right now, a peer-reviewed manuscript to share just kind of the nuts and bolts of what the organization is and how it's been set up. It does touch on mental health. I know that they were doing some other analysis with a psychiatrist to better understand the mental health implications that that have come up through the past 2 years. But as I stepped away from the organization, I haven't been fully plugged in to where that is now. I think that one thing we were concerned would be a barrier. We thought that mental health in the telemedical space would not be as successful. There's something that comes from being, face-to-face in person. And I think that that can be true. But what we've seen in patient feedback, at least as of up through July of 2023, was that patients were just unendingly grateful for the resource and that the mental health utilization as a ratio of our overall patient visits was just going up and up and up. And part of that is from the continuity that you need with mental health, since people tend to need multiple appointments rather than some other medical care that you might get, which is just, once a year or something like that. And so any idea where it will be shared? I'd love to see it.
Yeah,
oh.
Go ahead. Please go ahead.
Yeah, sure. So I don't have the journal off the top of my head in terms of where our first manuscript will be shared, and that's actually that's not primarily focusing on mental health. I could try to find out where things are at in terms of their current mental health research. I will say that the Health Tech Without Borders team has also been focusing on mental health. So they have been, they started out in Ukraine and then have since expanded into the Philippines. They are working in Africa, in the Sahel region, and then have been approached by teams in Tijuana as well, Tijuana, Mexico. And so they have a very interesting take on the mental health piece, because they have looked at not just the patient mental health, but the provider mental health when you're dealing with these really, really traumatic cases that come up. And so there's information on their website. They've done some education, like some webinars, specifically trying to educate providers on how to take care of themselves, and then also best practices when it comes to triaging some of the emergencies that can come up in telemedicine settings, specifically related to mental health.
Annalicia, there's somebody, Marianne McGrail is asking a question. Do you want to go ahead and talk, Marianne?
Yes, it's a question about doctor-patient confidentiality issues with respect to telehealth, and how you handle those, especially in a war zone, such as Ukraine. I mean, do you have any particular software protections, or how do you handle that?
Yeah, that's an excellent question. And I will say this is one of those pieces where it definitely takes a village. So because my background is clinical, I can't speak extensively on the data security measures that we took. But I will say that our legal protection came from Hogan Lovells, which is an international law firm that has offices both in the EU as well as the United States. And so every step of the way, we were trying to engage their team on the data security, making sure we were in alignment with GDPR, which is the EU's version of HIPAA, and then being cognizant of any HIPAA training. We did make sure that all of our volunteers had HIPAA certification so that they were cognizant of that type of discretion. And the that piece is very similar between GDPR and HIPAA. In terms of the safety of the software itself, we utilized a platform that was already in existence. It's called Clinico. So it's based out of Australia, but has done work, has set up hosted platforms in the European Union prior to our effort. And so they had both GDPR capability and HIPAA compliance built into their system that we could, by activating certain settings, we could make sure that we were meeting those requirements. The other piece that we had to think about, because our platform was completely virtual and all of the volunteers working on the platform had to find a way to communicate safely. So we had to make sure, there are certain considerations when you're communicating about patient information outside of the actual patient visit. And so that was a learning process as well. There are certain security requirements that come if you're trying to use Gmail or Google Drive, et cetera, et cetera. And I'm sorry that I can't speak to more of those specifics, especially because it's been over or almost a year now since I've been involved with them. But it's definitely one of those pieces that if we build that educational platform with the WHO Academy, we want to share resources for teams depending on which country or region that they're located in order to prioritize patient safety.
Thank you.
And I'm not sure. Yeah. One thing we decided as a team not to store or ask in any way were patient locations within Ukraine. I think I had mentioned that earlier, but that was just not worth the risk, even with all the precautions we were taking to protect their data. We just didn't want anything like that to become compromised. So that was an organization specific decision.
Thanks very much.
Any
Of
other
course.
questions that people have? Feel free to raise your hand or speak up. I wanted to share something with you and then ask you a question, Annalicia. People were asking about mental health response around the world. And what I was going to let you guys know, for those of you who are Red Cross, is that there is a International Federation of Red Cross psychosocial center that is located in Denmark and has been there for probably 25 years. And they provide psychosocial training to delegates, to national societies, national Red Cross societies, on how to best support the most vulnerable in time of armed conflict, forced migration, and disaster. And it's a wonderful program. You can look it up. It's in Copenhagen, Denmark. It's called the IFRC Psychosocial Center. I'll try to find the put it in the follow-up email that goes out next week for you. And so those are people who are expert in working in large scale and small scale disasters and conflict zones and what best works. And they have a special, I think it's, what do they call it? A podcast on what's happening in the Ukraine, which might be interesting for you. In any case, I'm going to stop talking now and ask you a question, Annalicia. We're talking about mental health. Somebody just asked, Janice Wilson just asked, how old is Annalicia? Somebody asked how old you were.
Oh, how old I am? I'm 32.
Oh, wonderful. Yeah. It's probably, look, you look 10 years younger. Somebody probably asked that. But anyway, what I was going to say is, thank you, Jonathan, for putting it in there. It's psychosocialcenter.org. In any case, what I was going to ask you, because I'm wearing my mental health hat now, is how do you best take care of yourself when you're working in conflict zones or you're working in areas where people's immune system is most arrested and you're working with the most vulnerable populations? How do you yourself take care of yourself? I only asked difficult questions.
No, that's a great question. Yeah. I give a lecture to the pediatrics residents at Stanford on their advocacy rotation about doing international work. And something I focus on at the start of that discussion with them is this idea of how to protect your wellness. An analogy that we use in medicine, or in pediatrics specifically, when we have parents who come in with some very, very sick children, is to remind them of the oxygen mask that comes down on the plane. You need to make sure you're taking care of yourself in order to take the best care you can of your child. And I think that goes for volunteers or people in the humanitarian space as well. And really all of us, I think, if anyone is on social media or watching the news, will come across so many different stories of really terrible things that are happening either close to home or around the world, and can feel very removed from our daily lived experiences. And that can feel almost paralyzing because it is hard to know where to start, and hard to know what you yourself can do to help out with all these different challenges and suffering that you might see. And so I think protecting that wellness is a really important piece when you're thinking about these really serious issues and disaster zones like you're talking about. So I think minimizing or figuring out what you are comfortable tolerating and what you're capable of is important. So, there are some physicians who are not comfortable taking care of kids dealing with child abuse situations and things like that. So maybe pediatrics isn't the best for them, but that's okay. And that's just an example where you need to set boundaries to protect yourself. But not luckily, but unfortunately, I guess there are plenty of other areas outside of pediatrics where there is still need. And so that can be said as well for what's happening today, both domestically and internationally. And so not trying to just overwhelm yourself with the doom scrolling, we call it, just reading about all these different stories. If you need to minimize that, set limitations on yourself for what information you're taking in, I think that's a really important first step, and something I still have to try to work on as well. And then when you're actually, for me personally, I think finding ways to take action feels the best. And so that's why I love sharing information like that 80,000 hours team or the effective altruism concept, because when you are able to work towards an issue and do something about it, that is very, that alleviates some of that mental strain that can come from awareness of issues, but that paralysis of not being able to do anything about it. Once you are being active, I think focusing on the wins, both for the people that you're working with, that are you're helping out or lifting up and empowering, as well as personal wins, can be a good counteraction for the mental health burden that can come from working in these spaces. So it's kind of a multi-step, paying attention to each aspect of being engaged in these spaces. Does that answer your question, Jill? You're muted.
Of course. Wonderful, because you talking about how you personally take care. I love the put on your mask yourself before the child analogy as well, because I use it all the time. And also talking about that you've set up a program for people who are starting off on how to do that. I think that's so important, because when you work in international conflict zones, and even when you work domestically, it's so important to take care of yourself first.
Yeah.
Otherwise, you can't take care of anybody else. So thank you for that.
Exactly.
Appreciate the answer. Anybody else have any questions as we wind up? Anybody else have any questions for Annalicia or the wonderful team, Joe Clendenin or Ken? Janice Wilson just put a thing in the chat. She apologized for asking such a personal question, but she's so inspired by your presentation and your words of wisdom. I was wondering out loud when I should have been quiet. I don't think so. That's what Janice Wilson said. I think it was fine to ask your age. You could always say, no, I don't want to tell
mind.
you.
I get it all the time in the hospital, so I take it as a compliment because I present young. So I am very humbled by what I've been able to accomplish up to this point in my career. I think it's been really fun and exciting. And so I love talking with groups like this because I can try to, get you guys excited about some of the things that I'm passionate about too. And yeah, I don't mind. I don't know. Hopefully I can help other people who look young, especially women, feel empowered to take action and just go for it,
Wonderful, Annalicia. Thank you. Any other questions or comments for Annalicia? Any burning issues or challenges before she gets off the line? I just want to thank each and every one of you from all over the United States, Samoa, and Hawaii for being on this call. Wonderful, wonderful to hear from you. Excellent presentation, and it was, I think, well received. I saw UCSC, my alma mater, on there as well. So there were educational institutions that were listening as well. I wanted to just thank you. And there are a number, if you look in the chat when you get off the phone, you'll see there are a number of people saying thank you, thank you, thank you. Excellent presentation. Appreciated how you tied anthropology and the importance of relevance of issues with voting. Thank you, Alicia. Yes, thank you for the presentation and your work. Great presentation. And lots and lots of wonderful things and lots of claps for you. I don't know if you can you see the claps?
Let me see. I don't know how to see the claps.
People are clapping. They're these little, oh, you don't get to see them? They're like hundreds of little claps. They're little yellow hands clapping for you.
Oh, great.
Did you know that?
Thank you all. No, thank you so much. Thank you all for your time. And Jill, thank you so much for inviting me to speak and talk about my experiences. Yeah.
And thank you for informative, so excited to help support the mission one day. Monica just mentioned that. And Christine said 100% clapping. She has 100% and then these two hands clapping. I've never seen that particular mojo, but that's wonderful. And then thanks. And a little circle with 3 hearts on it, with a smile on it. Yeah. I'm not used to emojis, so this is really fun watching this. And thank you, Ken, and thank you, Joe, supporting Annalicia today, and support from all your team, Neha, people from everywhere, all the people that support the Measles Initiative in the region. Thank you for all your support in making it happen. And Annalicia, today, it was delightful seeing you, and I'm so grateful you're here. And all that you got to look in the chat afterwards. I don't even know who the character is, but he has his hand in a circle with his thumb and index finger in a circle. Oh. Does anybody explain who that is? Somebody from Mass Care sent it, but I have no idea. Probably does anybody know what that emoji is? Nobody knows. Anyway, but there's a wonderful thing that you get to watch afterwards. Yeah. Anything else? Let's see. Anything else? Let me make sure there's no other questions in the chat. I think that's it, my friend.
Well, sounds great.
Annalicia, thank you for being on.
Yes.
Thank you all for being here from all over the United States. Welcome. We'll have another one the 3rd Thursday of next month. We'll talk to you about that in the follow-up notice. And Annalicia, if you have any other ideas or any other resources you want to give people, send them to me and we'll send them out next week. Yeah?
Yeah, sounds great. And I included my email in the chat. Yeah, yeah.
Pardon?
Oh, my email's in the chat, and I can give it to you as well, to share if people want to collaborate on anything in the future. So happy to do what I can.
Yeah, that's one. And you've got a few more emojis with a star and the sun and the mountains. And I mean, you've got to look at the afterwards. I don't know how to describe them to you because they're so different. Everyone's different. Roger Dangerfield, that's who. There's an emoji of Roger Dangerfield laughing. And it's Cindy Dickens here. I don't know who he is, but then somebody mentioned it's Rodney Dangerfield in the emoji.
Classic.
Just in case you wanted to know. Where can we find the recording? You're going to be sent the recording next week with the follow-up note of any additional resources, Nanya. So those people who couldn't come, there were lots of people signed up who had other meetings and couldn't come or were on disaster assignments. And we'll be sending out a notice to everybody who registered for this particular discussion group with a follow-up note, probably midweek next week. And any additional resources Annalicia thinks about. And I think that's it for everything.
All right,
I think you were so appreciated. You are so wonderful. Annalicia, thank you. Ken, thank you. Joe Clenendine and everybody who's on this call. Have a wonderful, wonderful weekend. Fantastic.